The recording for this meeting has begun.
And so without further ado, I'd like to quickly introduce the speakers and the learning objectives of each one. So first we have Patrick Hendry, Vice President of Peer Advocacy, Supports and Services for Mental Health America. And his learning objective is what a peer specialist does and how their work can benefit a healthcare organization. We have Melinda Fairbanks, Program Manager for the Returning Service Members at the Sheridan VA Medical Center. And her objective is finding a place and a role for a peer specialist on an existing care team. Laura Griffith is here with us as the Executive Director, and Lana Mahoney is here as the Training Director for Recover Wyoming. Their learning objectives include recruiting a qualified peer specialist leveraging state resources, how to provide training for staff in their organization to become a peer specialist supervisor, and ongoing training for peer specialists with state resources. And finally, the last person on the list is Janet Jarris, who is going to be joining us from the Wyoming Department of Health. And unfortunately, Janet is ill today and will not be able to join us. But the good news is Charles Smith, who is the Regional Administrator for SAMHSA, is here. And he will fill in the information that he was going to co-present with Janet on current billing opportunities available and other financial opportunities to support a peer specialist program. So thank you all again, and we will start with Patrick Hendry.
Sorry, I was on mute as usual. Hi, this is Patrick Hendry with Mental Health America. I want to talk a little bit about what a peer specialist is. I think most people are familiar, and why they're needed in our system of care. So peer support really goes back as far as recorded history. I mean, there's stories in Roman literature about soldiers meeting together to talk about their experiences in battle. So they were dealing with perhaps what we would call PTSD now. But peer support is a very unique type of service. It's the process of giving and receiving encouragement and assistance to achieve our recovery. Across conditions, peers offer emotional support, share knowledge, teach skills, provide practical assistance, and connect people with resources, opportunities, and communities of support. This was a definition written by Sherry Mead, the founder of Intentional Peer Support in the early 2000s. Since that time, peer support has evolved into even much more complex and rich type of service that we offer people. It's based on the practice of sharing lived experience. So a peer supporter is someone who has lived with their own mental health issues or substance use issues, has been a part of the system in receiving care, and has learned as they've gone along how to navigate the system and move into their own recovery. And now they're in a position to share that information with others. So, you know, a peer would go back, they go to meet with somebody, and they'll first introduce themselves because they want to build a trusting relationship. And that's the most important part of their work, is being able to make that peer connection. Because if you think about it, a peer is really only a peer if the person receiving the service acknowledges that. So just the fact that we may perhaps have a similar diagnosis or have experienced similar treatment isn't the only aspect that makes you a peer. And so what you do in the beginning as a peer is meet with people and get to know them and let them get to know you so that they feel that this is a trusting relationship built on mutuality. You know, peers are very good listeners. They help with decision-making and problem-solving, system navigation, advocacies, and perhaps most importantly, in connections to communities, because we know that isolation is a real problem for people living with mental health diagnoses. And we also know that isolation leads to poor health across the health spectrum. Peer specialists are often able to engage people who perhaps have resisted traditional treatment because they approach them as equals and have that common bond of lived experience. And so they go in with no agenda other than trying to be of service to the person. They're not counselors, they're not therapists in any way. They're people there to support someone in moving towards their own goals. So over the last 18 years, behavioral health has developed a real formal system for training and certifying. Before that, peer support, the modern version of peer support, kind of came out of the deinstitutionalization movement of the 70s and 60s and 70s. People came out of the hospitals, states across the country decided that it was time to move people from institutions back into the community. In the mid-1950s, we had over 550,000 people in state institutions across the country. Currently, I think there's about 55,000, and even perhaps that's too many. But as those people came out, these were people who had been damaged by the system. You know, psychiatric hospitals in the 50s and 60s were very unpleasant places for many people, and there was a lot of abuse that took place. So a lot of these people came out, and once they were released from the hospitals, there were no services for them to access, and many of them didn't want to access services. They referred to themselves as survivors, and when they called themselves survivors, they didn't mean that they had survived their diagnosis. It meant that they had survived the system that had mistreated them. In 2001, Georgia created the first peer certification and became the first state able to pay for peer support through Medicaid. This was a major occurrence. In 2007, CMS acknowledged peer support as an evidence-based practice. And this has allowed states across the country to find ways to reimburse for peer services. As integrated healthcare has grown a lot since we started the Affordable Care Act, peer support has expanded into primary care as we've begun to integrate primary care into behavioral health and behavioral health into primary care. Peer support really enhances primary care by giving people practical social and emotional support to help them to do the things they need to do to live healthy lives. So peer support may work in tandem with primary care, working with people who are perhaps living with chronic health conditions. In the 2000s, we began a movement of peer support moving into a whole health approach to support. And in this way, we've been able to help people to self-manage not only their mental health conditions or their substance use conditions, but also chronic conditions that they've lived with for many years. And we all know that when people take ownership of their treatment and they begin to self-manage, the outcomes are far better than they are when they're merely a patient who is told by a doctor, this is what you need to do, and the person maybe does it or they don't do it. And particularly in mental health, this has been a major issue of people not believing in the treatment that was being offered them. So perhaps they didn't take their medications or they didn't show up for their appointments. Once they begin to have that ownership, they become very interested in the treatment system itself because they're part of it. And a big process has come through all of healthcare called shared decision-making, which is where the individual, the patient, works hand in hand with the provider, the doctor or therapist, whoever, to make the decisions that decide what's going to happen in their care. So one of the big things that's happened also in the last 10 years or so, about 12 years, I think, is that managed care has begun to take over most of Medicaid treatment in the country. So many states now have managed care contracts out. And in the beginning, the peer community was resisting it because they looked at it that here's another layer of bureaucracy between me and the funds that are available for my treatment. So managed care would come in, and of course they're going to take a percentage off for their services, meant that there was less money available. But actually the opposite has happened in a way in that managed care has been able to streamline services in many states, and they have been able to find economies of scale. And one of the things they've done for peer support is that many of the big managed care companies have built peer support into their contracts. And so they hire peer support staff to work in the areas where they are providing managed care. And the other thing they've done is they've kept extremely good statistical information. And this is something that we've been lacking in peer support, the evidence to show the efficacy of peer support. And so their evidence has now shown that not only is there an increase in satisfaction with service, but people rate their own quality of life as much stronger. And they also say that it strengthens their ability to participate in their own care. We also see really significant reductions in rehospitalization rates in a type of program called the Peer Bridger model. They've seen as much as a 70% reduction in rehospitalization in those critical 90 days after a person is released from the behavioral health hospitalization. So peer support is now growing into a big industry. We now have over 30,000 certified peer specialists working across the United States, and many others who are not certified. Right now, 46 states offer certification. Each state has its own model of certification, which has caused some problems in that credentials can't cross state lines. There is one advanced national certification that's offered by Mental Health America, and the idea there is to provide something that larger healthcare organizations and funders like health insurance can rely on, that if they hire peer support or reimburse for peer support in Washington State, and they do the same in Florida, they're going to get the same standard of care. So I'd be happy to take questions. I believe we're going to do that at the end. Invite you to visit our website for peer support, which is just centerforpeersupport.org, or contact me at the email address shown on the screen. So thank you.
Thank you, Patrick. Melinda, are you ready to make your presentation? Please take over.
I am. Yeah. Absolutely. So I did not put together a PowerPoint because I have a couple of flyers that I'm utilizing instead, and wanted to take the opportunity to just have an open dialogue and conversation with you all about how the VA is using peer supports. So as Patrick indicated earlier, the VA started utilizing our peer support specialists in 2007, and we set up a national program and hired them at each of our facilities. In Sheridan here, we have 4 peer support specialist positions, and one of them specifically works with the primary care providers in the medical part of the house. The other 3 work in tandem with our clinical teams and our medical teams in our residential setting and our inpatient acute psych setting, as well as outpatient mental health. So we've really taken advantage of the unique perspectives that peer supports bring to the table and incorporated them into all areas of our services that we provide to our veterans. And so specifically, some of the best advantages that peer supports bring to our teams is that they can do a wide variety of things that other providers probably don't have time to do. especially in a primary care setting where it's very fast-paced and it's busy, and you're already under a lot of pressure to complete all of the things that you need to complete with that encounter with that individual. And so our peer support specialists are certified. We work a lot with the Recover Wyoming folks and the state departments of health around the nation for our certifications. And with this certification, the peer support specialists provide the opportunity for wellness and recovery groups. They do mindfulness groups. They do outpatient substance use disorder specific groups. We also have a men's military sexual trauma group that one of our peer support specialists is facilitating. And then they do a lot of relational groups. And so there's specific techniques that the peer support specialists can utilize, real life examples of people struggling with certain issues and illnesses, and help the group co-facilitate that discussion of what they would suggest to help that person move forward. They also do a lot of our co-facilitation of our clinical groups, and they do individual support with all of our veterans as well. And one of the things that we've really been working with them on lately is more of a case management type realm where if we have people who come into the facility who need assistance with contacting different housing options, setting up transportation, scheduling appointments, navigating the VA system, looking for resources outside of the VA, and helping them fill out applications, the peer support specialist is really the person that can sit down with them and spend that time to do that. And then one of the things that they also bring to the team is helping to train our interdisciplinary treatment teams and our medical teams on the recovery model and the recovery process. And they bring a really unique perspective to that. They help increase communication between providers and the patient. And then the elements that they bring to the patients or the veterans are really just incredible. Because they are people with lived experience with mental illnesses or other comorbid health diseases, they've been trained to share their experiences and their personal stories in a helpful and a safe way. And so this provides a sense of wellness and self-worth to the people that they're talking to. It validates their own illnesses and their own struggles. And it helps motivate them to do more and to be more engaged in their own treatment and well-being so that they can get better. When you see somebody who has, a serious mental illness disorder like schizophrenia, who has stabilized and worked hard in their recovery, and they're now gainfully employed full-time at the VA working with other veterans, it's very encouraging to people who sometimes get stuck in those traps of, I'll never get better, it's not curable, I'm always going to be in this place, and helps move them forward to these other opportunities. And so that's really how we, as the VA, at least here in Sheridan and in Wyoming, have incorporated these peer support specialists into our system and into our different elements. Specifically in primary care, our peer support specialists, one of the things, as Patrick said, is decreased hospitalization. Here in Sheridan, in our primary care unit, a lot of our admissions are related to substance use disorder and detox. And some of those patients tend to be reciprocal. So they come and go, sometimes in the same week, sometimes in the same month. And it's a lot of repeat hospitalizations. And so we've integrated our peer support specialists into that unit to help meet with those folks and try to engage them in outpatient support. And that has shown a reduction in decreased repeat admissions and more engagement in the outpatient mental health services like IOP or some of our outpatient individual or group psychotherapies. So it's been very, very helpful. for our peer staff and for our primary care staff who don't have all of the listings of the groups that we offer and don't know exactly how to navigate that system themselves. Having those peer support specialists do that with the patients for them is really, really helpful. So I'm sure Charles Smith will bring this up in a little bit, but you can see here we have the SAMHSA flyer, and then I also distributed the VA flyer that we have for peer support specialists for the poster session, so that's available as well. And then I will type my email in the chat box, so if anybody has any questions or would like to talk more or would like to have some of the resources that the VA has developed for training for peer support specialists, we'd be more than happy to share that.
Thank you, Melinda. And let's go to Lana is here to talk with you next.
Well, as was mentioned previous, my name's Lana Mahoney. I'm a woman in long-term recovery. I'm also a peer specialist and the training coordinator at Recover Wyoming. And so today we're going to talk a little bit about how you can recruit a peer specialist for your agency utilizing existing state resources. So we came up with a couple of options on how this could be done. One of the first options is to recruit a peer specialist from the 78 persons currently certified in Wyoming. And so this number is current as of December 3rd. And for us, this is really amazing. The growth of peer specialists over the past couple of years has been significant. And so we thought we would share with you a little bit about the history of peer specialists in Wyoming. Uh-oh, you might have skipped a couple slides. Seems like we're missing a couple slides there. So in 2005, the first peer specialists were hired. Initially, this was seen as an opportunity to give people in recovery employment. And as time went on, people recognized the value of the peer specialist's lived experience. And so those jobs continued to grow. So by 2007, the number of peer specialists had increased, and Medicaid recognized the paradigm shift that emphasized recovery and a life in the community. So the distinct provider type of peer support was included as a billable, evidence-based Medicaid service. And so to follow those requirements for Medicaid, a team was formed to create the peer specialist certification in Wyoming. And that was done, let's see if I can go forward here. It seems like we're missing some slides. So in 2015, the Wyoming Department of Health received a SAMHSA-funded brass tacks grant. So just to make that clear, SAMHSA stands for the Substance Abuse Mental Health Services Administration, and brass tacks stands for Bringing Recovery Support to Scale Technical Assistance Center Strategy. And they are available for technical assistance for a wide range of topics, including peer support. So what happened was they received the grant from SAMHSA, and that grant was used to create the actual training program that we now utilize in Wyoming. And so peer specialists and a number of other stakeholders got together, and they created the Wyoming Peer Specialist Code of Ethics, as well as the core competencies. And that is what our peer specialists in Wyoming currently use to help model their practices. So let's see. The first Wyoming Peer Specialist training was held in 2016. And I believe before that, peer specialists had to be trained out of state. I know that a number of persons had gone to Arizona and other places that were currently utilizing a certification program. However, once the curriculum was created in Wyoming and we were able to certify here, that began in 2016. I think it was in 2017 is when Recover Wyoming contracted with the Department of Health, and we have been coordinating and facilitating the trainings since then. And I believe, I don't have my numbers, but I think 54 peer specialists so far have been trained through the training that Recover Wyoming provides. And I'm missing all the other slides. So back to this slide. Sorry about that. We're missing some of our slides. So again, this graphic that's been up is just kind of showing the growth of peer specialists here in Wyoming. And it's really amazing, you know, that now in 2018 we have such a great interest. So if people are interested in finding out about recruiting a peer specialist, you can either talk to Danny Sullivan at the Department of Health or Janet Jarris. Janet will be leaving, she'll be retiring next year, so Danny will be taking her place. You can also contact me, and I will have information regarding current certified peer specialists in the state. So another option is to identify persons within your agency that may qualify for the peer specialist role and then get them training to become certified. This is kind of a unique opportunity for you to have discussions with your staff about, you know, there may be people within your organization who are currently in recovery and who might actually have the lived experience that they could bring to the table. So this could be an opportunity for career advancement for someone that you're already working with. So utilizing a peer specialist and implementing a peer support program will take some preparation. And so you'll see on the right-hand side under the files that we've included a PDF version of the peer specialist agency readiness self-assessment. And so this is kind of a big document. So we won't go through this today, but you can download this and take a look at it later. But it's a good tool to kind of assess where your agency is now in terms of their commitment, capacity, and culture to incorporate peer specialist services. And so I wanted to just briefly make a couple comments. So in regards to commitment, some of the questions you might ask is, does your staff have an understanding of what peer support is and what the benefits are? Will your staff advocate for peer support inclusion in your existing array of services? There's a number of other things that you can take a look at that might assess your commitment level. In terms of capacity, you might ask, how will you provide the people you serve with information about your peer support program? And how will peer specialists be trained on their job duties within your agency? So again, those are just some things that you might want to think of prior to implementing a peer support program. Finally, you might want to take a look at the culture within your agency. And this is a good one to explore. You might want to find out, does your organization promote a culture where peer support program would be valued? And does the language and viewpoints of staff demonstrate that recovery is possible for all the people you serve? So these are just some of the things you might want to explore prior to hiring a peer specialist. And again, this is just note that you can click on this document here and download that agency readiness assessment, which we modified from the Idaho Peer Support Specialist training. So now we're going to talk briefly about training for peer specialists and other agency staff. So with collaboration and funding from the Department of Health, Recover Wyoming provides the coordination and facilitation of the new peer specialist training. As I mentioned before, from spring 2017 to the present, 51 people have completed the new Wyoming Peer Specialist training. The training was developed, as mentioned before, based on content that is seen nationwide. We have a variety of topics that are covered, including work competencies, Medicaid documentation requirements, group work, behavioral and physical health interactions, coping strategies, resiliency, trauma-informed care, and many others. There's also a written test at the end of our training just to assess that people are competent in those areas. For some reason, none of our slides are working. So this would be where we have the upcoming training opportunities through Recover Wyoming. Right now, Recover Wyoming has contracted with the Department of Health through our Peer Specialist Foundations grant. This will allow that over the course of the next 2 years that we will provide a total of 4 new Wyoming Peer Specialist trainings. We just completed one in October in Laramie, so we have 3 remaining. Our next new Peer Specialist training is scheduled to start in April. We currently have 41 people on our interested list for that training, which is crazy because we can only take about 15. So unfortunately, there's going to be a great deal of people that will not be able to attend initially. Laura and I have been talking that maybe we could get some additional funding to help accommodate that need. So, you know, we'll keep our fingers crossed for that. So in addition to those, we will be doing a supervisor training, and that will be done via the web. We will be utilizing Zoom to conduct it's a 4-week, 2 hours per week training completed virtually that will assist supervisors and other agency staff to help incorporate the supervision element of peer specialists on their staff. We are currently in the draft of the registration form, and so we will make sure that all of you get the link to that once that's available. That's scheduled to start, I think the first session is January 25th, so hopefully in the next few days we'll have that information available. We will also be providing a basic forensic peer specialist course. In May, we had Liz Woodley from the Pennsylvania Mental Health Consumers Association come down. She trained over 25 of our current peer specialists to be forensic peer specialists, and so we will host another one of those trainings in 2020. In the meantime, we will have a forensic train the trainer session, which will be in May. So if there's any current Wyoming peer specialists on today, I know Cherokee is one of them. If you have already attended the forensic training, you will be eligible to do the train the trainer program. Pardon? Oh, okay. A forensic peer specialist is someone who works with justice-involved individuals. It can also mean that peer specialists are incorporated in different intercepts within the criminal justice system. This could include, you know, in booking at the jails. This could include directly in a sentencing atmosphere within the prison system, you know, connected with probation and parole. There's a number of levels of intercepts that forensic peer specialists can be included. So we're excited to add this, and we're hoping that we can utilize more forensic peer specialists within the different systems here in Wyoming. So those are the current training opportunities that we have. In addition to what Recover Wyoming provides, there's a number of trainings that are available online. I know that Doors to Wellbeing has a monthly peer specialist webinar on all kinds of topics that I regularly attend, and I know many of my other fellow peer specialists attend. Also, you can get online Brass Tacks, SAMHSA, Peers for Progress. There's a wealth of information regarding recorded webinars, ongoing trainings, numbers of opportunities to learn more about what peer specialists are and how they can get trained. So, I think that's all we have for that. If you have any questions regarding training, please contact either Danny Sullivan, Laura Griffiths, or myself.
So good afternoon, everybody. This is Charlie Smith. I am the Regional Administrator for SAMHSA, and I have the pleasure of talking just a couple minutes with all of you about some current billing opportunities as well as other financial opportunities that can support a peer specialist program. Unfortunately, my co-presenter, Janet Jaros, is out ill today, and so I'm going to do my best to briefly be a Janet Jaros. And while everyone is laughing, I hope you are too. Clearly, I defer to Janet as well as to Danny Sullivan, as Melinda had indicated, that they're key leads within the state for understanding the Department of Health and specifically the Division of Behavioral Health's opportunities around funding for peer specialists, and very specifically with regard to the role of Wyoming Medicaid. But there's some clear cost and benefit features which folks have mentioned today. The value of peer specialists is that it does free up licensed staff time. There's enormous value to improving the cost for communities and specifically your agency, which can be reduced by the inclusion of peer specialists. Many of you are probably well aware that within the federal government's support of community health workers, which have been substantially supported by the U.S. Department of Health and Human Services and specifically HRSA, community health workers add that additional value to our communities and our community health, as well as the transition of those individuals with chronic illnesses that are being seen by our primary care as well as long-term care systems. So much like a community health worker, peer specialists add enormous value to our delivery of health care. Clearly, Wyoming Medicaid is a significant opportunity. Each state has its own Medicaid program, and each state then is able to carve out within that Medicaid program the added benefits and or reimbursement portfolios that support community health workers and peer specialists, and that's where I strongly defer to the Department of Health for greater insight into that area. As for me, let me kind of highlight a couple of additional opportunities, and I kind of formatted this slide in a way of kind of breaking down where these funding opportunities might exist. Clearly, for both grants and contracts are available from the federal government as well as from states and in some cases foundations. And we see the use of grants and contracts to support the role of peers in our communities and through our agencies in a variety of ways. You see them actually being funded out of departments of health or very specifically divisions or departments of behavioral health. We see that our public health state agencies are oftentimes making grants and or contracts available to support peers, as does education, housing, child and family services, our criminal justice and correction programs have demonstrated that they can build grants and contracts to support the use of peers in their specific programs. And this might be an opportunity based on the direction and opportunities that exist in Wyoming where you might be able to link with various state and or federal agencies in these oftentimes time-limited opportunities to support peers. In addition, what we are definitely seeing is a growth in the recognition and importance within our insurance systems, whether it's public insurance, which historically is Medicaid and or Medicare, but we're also seeing this within managed care as well as our private insurance markets, our commercial insurance, where they're recognizing the enormous value that peers have in reducing costs, increasing staff time to be able to actually deliver health care. But most importantly, we're seeing better return on the investments of our health insurance by actually patients being healthier. They're getting better, they're managing their chronic illness independently or with the assistance of peers after certain recovery and treatment plans are well in place by our healthcare professionals. We're actually seeing in several insurance markets in Montana as well as in Utah and Colorado where private insurance, the commercial side of, for example, Blue Cross Blue Shield is recognizing and supporting the use of peers and reimbursing for the use of peers both in a managed care environment as well as a fee-for-service environment. A couple examples of federal funding, and I'll do my best to mention each of these acronyms. As you probably all know, the federal government is tremendously adept at developing acronyms. SAMHSA, which I indicated earlier, that's the agency I am with. SAMHSA funds a number of initiatives that support funding, both short-term and long-term funding, that can pay for the use of peers in a variety of healthcare settings. SAPT stands for the Substance Abuse Prevention and Treatment Block Grant. The state of Wyoming, the Wyoming Division of Behavioral Health, receives that block grant, and that block grant has the ability to support the use of peers working in addiction treatment and or in primary care and hospital care environments where substance abuse peer specialists can be used and paid for. STR, SOR, TOR, State Targeted Response, State Opioid Response, Tribal Opioid Response. This is a portfolio of funding from the federal government that is in response to our significant national opioid epidemic. Every state, including Wyoming, receives these funding, and tribal is for specific tribes that receive opioid-related funding. Each of these funding areas can be used to support the use of peers to address opioids. The state peer networks is a specific discretionary or competitive grant that SAMHSA puts out, as well as the building recovery communities is actually what it should state, is a very specific grant that supports recovery and the use of peers in building communities of recovery for individuals with mental health and substance abuse. That just gives you a taste of the different types of SAMHSA funding, and there's a variety of other SAMHSA funding where you can go to our website, www.samhsa, for a longer list of potential funding opportunities to support peers. HRSA, my guess is most of you know, HRSA stands for the Health Resources and Services Administration. They fund the BWIT, Behavioral Health Workforce Education and Training Grant, which actually is a training grant that not only supports building a behavioral health workforce, but also a part of that grant can support the training of peers and providing specific scholarship for peers to actually have some practical experience. Universities are eligible to apply for the BWIT grant, and that typically has been offered on an annual basis to help build not only the licensed practitioner workforce, but also the peer workforce, which is an opportunity. FORHP is the Federal Office of Rural Health Policy, which is part of HRSA. They are currently offering, and have been for the last couple of years, community planning grants where communities and community health agencies, rural critical access hospitals, and other community departments can actually apply for grants that might be able to uniquely look at the building of peers within their health networks. And so the community planning grants can be an opportunity to help build peer networks within your areas. CMS is the Center for Medicaid and Medicare Services, and as was mentioned earlier, there was a 2007 letter by CMS to states encouraging states to examine and build the use of peers within their Medicaid portfolio. In addition, the rehab option of CMS has been a method by which states have been able to pay for the use of peers, community health workers in both mental health, substance abuse, as well as primary care and hospitals. As well as currently there's a significant push within the federal government to use the CMS 1115 waiver to build out integrated behavioral health care with primary care, as well as the use of peers in those federally funded, Medicaid-funded systems. In addition to Health and Human Services, the Department of Defense, the VA, as was mentioned earlier, is a significant supporter of peers in our healthcare delivery system, as is the Department of Justice. Bureau of Justice Assistance, so BJA, has specific funding, and they've been doing so for over 10 years to support forensic peer specialists in both community corrections, probation, as well as parole, and there is a growing interest of the role of peers inside correctional systems, which historically have not had great foundation for funding, but we're seeing that changing through the Department of Justice. DOL is the Department of Labor. The Department of Labor is really understanding that they have a significant role, particularly with regard to their well-funded apprenticeship programs, to actually build structures to support peer training, peer certification, as well as ongoing application of peers in our healthcare industries underneath their apprenticeship programs. HUD is the Housing and Urban Development, and housing is definitely being championed, as housing is healthcare, and it's an opportunity where peers can play a significant role with regard to case management and linking individuals with chronic illness back to primary care from a housing environment. And then finally, the U.S. Department of Agriculture, particularly for this region, which is significantly rural and frontier, and in some cases wilderness. We understand the important role of connecting individuals to healthcare, in some cases bringing healthcare to individuals. USDA has a platform of rural development grants and community grants that actually can help fortify our rural and frontier communities in the support for peers and peer specialists. Interestingly, in Grand Junction and Glenwood Springs, Colorado, USDA and the state have partnered to provide additional training to EMT to do house-to-house visits using emergency medical technicians who may not have a call to actually be doing home visiting with an understanding of their role as peers of the healthcare community and peers of the individuals of that community. So it's been a nice kind of example where USDA and the state have partnered together. Finally, I want to kind of reemphasize that the community health worker model is one which is very similar to peers. It's been used not only in the United States, but also internationally. The community health worker model is fully supported by the World Health Organization, which provides an additional buttress to the role and importance of peers within our communities as being our healthcare connectors and experts. Finally, I just want to say, please visit SAMHSA's website. As was mentioned, we have a host of webinars, we have a host of tools and toolkits, and as the lead federal officials concerning mental health and substance abuse, we have been a staunch advocate for the role of peers across our entire healthcare system. Finally, a special thank you to the Wyoming PCA for sponsoring this webinar, and we, I believe, are welcome to answer any questions at this point. So thank you very much.
Absolutely. So please do unmute your phone and ask a question, or if you want to, you can ask a question in the chat box, whichever you're most comfortable with. We still have a little over 10 minutes, so there's plenty of time for you to put these folks through the hoops to get more information from them. Okay, so we do have this question from Carol in the chat box. Any suggestions as to how to overcome this barrier, especially for Tribal 638 facilities that are community health centers, FQHCs by definition?
This is Charlie. I'm looking at this a little bit more specifically, Carol, and I do think that some of this might require a kind of a multitude of perspectives and voices to truly understand this. It's my understanding, and I think what you're quoting, is that Wyoming's Medicaid has allowed for community mental health centers to bill for peer specialists. This has been, as was noted earlier, one of the key features of the kind of block granting and building out of healthcare services and reimbursement at the Medicaid and block grant level back into the late 70s, early 80s, and this was one of the elements that broke out from that. But within Medicaid, each state has an opportunity to include other healthcare agencies beyond just community mental health centers. This is clearly one kind of barrier that not only Wyoming, but many other states have seen, is that they've had Medicaid kind of in a compartmentalized way, only reimbursing for community mental health centers where peers are operating. We are seeing that changing. New York is a great example where New York has expanded the use of peers within primary care or community health centers, but that's clearly a conversation I would strongly encourage not only you, but also the Primary Care Association, as well as the State Department of Health, including the State Division of Behavioral Health, to really come together to understand funding mechanisms that are going to be of value, shared value across all of the healthcare systems, not only community mental health centers, but also primary care, tribally based healthcare systems, as well as the hospital system.
Anybody else want to add to that? Carol, does that answer your question for now? And then, yeah, there's obviously room for improvement there.
And I might add, Carol, that the federal regional office, not only for SAMHSA, but I believe also for CMS, would be happily able to partner with you in that conversation, understanding that we might be able to bring some more value to the various perspectives, but ultimately it is a state decision and we fully respect that.
Okay, wonderful. Thank you. Carol, okay, there we go. Okay, wonderful. All right, anybody else have questions? Please do go ahead and join us by voice or join us in the chat box. So I have a sort of question with Melinda's presentation about doing peer specialists in the VA. That's sort of governed by the federal government. So do they recognize peer specialists as a different level than states do? Is there anything that we can replicate there?
Melinda, do you want to take that one first? Melinda may have left. Well, this is Charlie again from SAMHSA. I'm not aware that there's any differentiation in the training. I do know that the Department of Defense and specifically the Veterans Administration have strongly recognized that veterans are enormous advocates for veterans. And with that, veterans understand from that real-life personal experience the importance of having that experience, the importance of understanding a military culture, and how healthcare and that military culture go hand in hand, not only while in the military, but also transitioning outside of the military. So there's a unique skill set, but I would not say that's a skill set that does not have elements of great value and crossover. And I would also strongly encourage that individuals not having had that military background or working in the VA strongly get trained in understanding the military culture. Over 53% of individuals who are active duty or veterans do not seek care in the VA system. So they're coming to the FQs, the CHCs, the critical access hospitals. They're gaining access to the community mental health centers and Wyoming recovery centers. And so having that cross understanding is important regardless of a peer. But the credentialing may be unique to the VA, but I do think the cross training is important.
Okay, wonderful, wonderful. Thank you. Other questions? We still have about 6 or 7 minutes or comments from the speakers.
There's another from Carol.
Oh, okay. Is there a specific peer specialist certification training for peer specialists serving youth versus certified to serve adults?
This is Lana. Not that we're aware of. In the state of Wyoming, there's just one universal training. At Recover Wyoming, we only serve people 18 or older. So utilized in our world, our peer specialists, work primarily with adults. I don't know that there's a distinction. I think There may be some additional skill sets that might be involved with serving youth versus adults. However, a lot of the skills taught during our training, I think, could be utilized working with both populations.
This is Patrick. A number of groups have been addressing this for a while. Youth Move, probably the largest one concentrating on it. The issue with providing peer support to youth under the age of 18 is very difficult because it's very hard for an adult to really have that peer-type relationship with somebody who is, maybe even 15, 16, or younger, possibly. So there's been a lot of work to provide training within schools that is not to create a position of peer specialists, but to provide kids with the same tools that are available to peer specialists. So listening tools, goal setting and solution building tools, ways to engage people. And they utilize this basically as a friend. And it's in the few states that have done this, it's been very successful. Some of the managed care companies have addressed youth peer support by having people from 18 to 24, because also in that youth group is usually transition age. So we go 18 to 24, but they'll have people of that age still working with kids in high school level. I don't know that anybody will ever solve the problem of having a true peer certification and type of job for somebody under adulthood, but I think by providing these training assets to schools, you kind of reach the same goal.
Patrick, this is Charlie. I'd like to add, and I'm glad you kind of raised those issues. Young People in Recovery is a national organization that is actually very specifically targeted for youth and young adults, and obviously age ranges can really vary, but they typically are 14 up to around 26, and actually, interestingly, YPR is based in Denver and available to those individuals in recovery from a substance abuse issue. There are a number of other kind of national groups. Interesting, the Department of Education several years ago funded a number of variants which was connected to positive behavioral supports within our middle and elementary schools. And they trained students, even in 5th grade, to be conflict resolution peers, to actually help reduce conflicts in the playground. My daughter actually went through that in early 2000s. So a number of these kind of connections where students can be peers, obviously with appropriate support and supervision, to really make sure that not only the students who are receiving that, but also the students who are being the peers are getting that ongoing support with very clear delineation of roles and responsibilities. Peers are very specifically important. The last thing is mental health first aid, which many of you may be familiar with, has developed a peer training for adults to work with peers. They're now going to be rolling out a specific mental health first aid program delivered by youth for youth, rather than being just adults delivering to youth. So we're seeing that kind of grow with various kind of elements that have to be considered.
Excellent. Great information. Thank you. I think that there might be another question coming up on the chat box. Cherokee, did you want to ask a question? We certainly still have time for that. So I'll wait just a minute for you, and then anybody else can speak up if they have a question. As we wait for that, I just want to make sure that I say thank you to the speaker panel, eminently qualified and wonderful people to come here and do this with us. We're so pleased that this has been able to be put in place. The Primary Care Association is working with our health centers around opioid abuse and other substance abuse and mental health issues. And this kind of opportunity doesn't come along very often, so we really appreciate everyone. And again, I want to thank Hannah for putting this together. Sorry that she couldn't be here today, and obviously we want to catch Janet before she retires because we know she's counting down the days. So Cherokee, we're going to leave the line open for you for a minute. And Carol, thank you for your questions.
This is Charlie. While Cherokee is writing, sometimes it's hard to keep me quiet, as many people know. I do really want to emphasize something that Lana had mentioned earlier. It's tremendously important as you are thinking for the inclusion or growth of peers within your organizations, that there's a very good organizational philosophy and attention to the need of training supervisors of peers. Peers can be supervisors. We also know that other healthcare professions may be supervisors. There's a specific and unique type of training that needs to be considered and developed. There's a number of organizations that are building that out, but our supervision of peers is tremendously important so that they can have a tremendously valuable experience, and it fits very well within your organization. And really want to look at Mental Health America and Patrick's work, as well as a number of other programs that are doing that and making that available to you.
Wonderful, wonderful. Well, I think this was well received, but again, please do take just a minute to do our evaluation when it comes up at the end. And I think we're right at 1 o'clock, so we'll close the call. Thank you again, everyone.
Thank you.
Thank you.
Thank you.